Good morning, everybody. My name is Peter Davidson and I am from Montrose Community Trust, which is the charitable arm of Montrose Football Club. And for the last few years, I've also had the pleasure of being on the board of the EFDN. So thank you for joining me for this presentation. I'm sure, or I hope, it will all work well. We have IT support from our host Shazad in the background if need be. So I will take you through this presentation. I don't intend on keeping you for the full 45 minutes. We will allow time at the end for questions, and there is a short video that I would like to play at the end if it allows me to, and just to bring the project to life. So Montrose, for those of you that don't know, Montrose is a very small town on the northeast coast of Scotland. On a map in Scotland, we'd be in between Aberdeen and Dundee. Now, Montrose is a port town, as you can see from one of the photographs, on the east coast of Scotland, and it benefits from securing a contract for renewables. So there are a number of boats coming in and out, and something I explained in the round table with Holly just recently to the group on the fundraising round table was that we benefit greatly from a community anchor fund that we have developed, whereby every boat that comes in and out of the port pays a small community levy, a small community charge, and that then comes to us to put to good use in our community. And we reckon that will benefit us to the tune of about 30 or 40,000 pounds each and every year, which is fantastic. So to put the size of our town into perspective, our 12,000, I've just randomly picked a couple of fellow EFDN member clubs, and the whole of our town would fit into the West Stand at Stamford Bridge, owned by Chelsea Football Club, and also our whole town would fit into the new fantastic Intility Arena at Vålerenga. So a very small town, but one that we love. Now, Montrose Football Club, for anyone that doesn't know Scottish football has 4 professional tiers, and Montrose Football Club currently play in the 3rd tier. We won League 2 just 2 years ago to win promotion to that tier. But when we joined EFDN, actually, in 2015, Montrose were club 42 of 42 professional teams in Scotland. So we were officially the worst professional club in the country. But fortunes have changed both on and off the pitch. And when COVID struck and ended our season last year, we were fully believing that we would have won promotion into Tier 2 of Scottish football. So we'll go again and try our very best to secure that this coming season. And we've certainly started well and are currently sitting in 4th place. So Montrose Community Trust, the charitable arm that I am the founder and chief executive of. On a weekly basis, we deliver 34 weekly programs. We exist to use the power and widespread appeal of football to inspire change in people, but also in communities. Now, we exist to support the most disadvantaged in our community, whether that be those who are unemployed, living in poverty, living with a disability, recovering from an addiction, living in social isolation, or children and young people who are disengaged from mainstream school education. Now, as this slide shows you that we engage with 1,400 people each and every week, that may be quite a small number in comparison to some of your own work, but it's certainly a huge number where our town is concerned. In fact, it's over 10% of our town's population each and every week. Now, our youngest participant this week will be 18 months old as part of our parent and child physical literacy program. And we're grateful that we're able to run that at this minute in time. Our oldest participant, not this week due to COVID, but traditionally, would be somebody in their 90s, 94 years old, for example, through our Football Memories Reminiscence programme. We're fully embedded into our community. We work with a number of partner agencies, whether it be the local council, local social work, police, and all other emergency services. Now, I will let you take the opportunity to read just 2 testimonials that we have received recently from different programs. The one on the left being our Football Memories Reminiscence program. Football is a wonderful tool, and it has an ability like only music, I believe, to reach and engage and positively influence people in a way like no other. So this gentleman benefited greatly from our work, and there's a gentleman featured in the picture on the right who stated that had it not been for our Walking Football program or Football Memories program, Football Fans and Training program, my apologies, then he doesn't feel that he would be here today. Now, this is someone who possibly refuses support from other more clinical statutory organisations, but is more than happy to come and be supported by his local football team. So at the bottom of the slide there, it tells you that recent feedback has shown that 100% of our weekly participants enjoy our programs. They enjoy getting out of their house and taking part in the wide, extensive range of activities that we have to offer. But in fact, 1 in 4 actually admit to relying on such work, whether it be for physical or emotional well-being. So when COVID struck, it was important that we didn't hide. The easy option for me as chief executive of a charity with staff at a time when we weren't going to be able to generate any income ourselves would have been to shut the door and try and appear at the end of COVID relatively unscathed. But that's not who we are, that's not what we do. And if 1 in 4 of our participants rely on us, it was important that we stepped up and did something about it. But when we closed the doors of the stadium on the 23rd of March, we thought we were going to be away for 2 weeks, 3 absolute maximum. So we didn't have a long-term plan on how we were going to support our community. All we simply did was go home, stay in our own garden and produce a video. And this stay-at-home, pass-it-on video that we launched on social media went viral. It was simply a message portrayed by our participants, our staff, our football players at the professional club, and also legends that are well known to the club and the charity. And the message was simple: stay at home, pass it on. Try to protect your community, protect the NHS. We passed that message on to another club, St Johnstone Football Club, and their charity, Saints in the Community, and they subsequently did the same with their participants and passed it on to Big Hearts, I believe. So when we did this, we thought that this would suffice, and everyone staying at home for 2 weeks would be the extent of our support required. But as COVID developed and lockdown continued, we decided that there were real issues, real need in our town that we were very well placed to address. So we launched a COVID-19 Community Assist Scheme. Now, the Community Assist Scheme, as it shows on the poster on the left-hand side, had 5 main strands planned, but it soon developed into having 11 different strands as further need was identified in our community. But simply, we planned to tackle poverty and hunger, tackle educational attainment amongst children who were at home during lockdown, tackle the ever-increasing problem in our community of loneliness and social isolation, and of course, try and have an impact on some of the physical and emotional impacts that were caused by COVID-19. So I'm going to take you through just some of the areas that we supported our community in. And if you have any questions, when I stop sharing the screen, I'll take those questions at the end, and then hopefully, all going well, we'll play the video to finish. So the first thing that we sought to do was support the many children and young people that were at home during lockdown. Now, many children in our town don't go to school for the full week. Many come to the football stadium for their education instead, as part of an alternative curriculum that we deliver called School of Football. Now, the children that attend are both primary school age and secondary school age, and they are considered to be disengaged from mainstream curriculum. Now, there are also a number of children and young people, and families for that matter, in our town that don't have access to a computer, that don't have access to a smartphone. So any work that the school were doing in putting learning online was still not able to be accessed by these children. So we spent quite a significant sum of time, but also money, in producing, but also purchasing educational activity packs themed on football that would support children and their parents in maintaining their education in the areas of health, literacy, numeracy, and science. Now, I mentioned earlier that Montrose is a port town, and we have the Montrose Port Authority. So we can't assume that everybody would be enthused by football and engage in learning through our football activities. So the port supported us, or we supported them, sorry, in developing an educational resource pack themed on the port, the boats that visit it, the staff that work within it, and the work that boats do, particularly in relation to environmental sustainability. Our staff went out and delivered these resources, and we asked children to, if possible, communicate with us as to how well they were getting on. For those that did have the ability, take a photo, send it in, and we awarded prizes based on some of the activities that were done, such as designing the new strip for Montrose Football Club, amongst others. Now, in an attempt to support physical activity levels, we bought 500 footballs of different sizes and colours, and we offered these out to our public, in particular those living in poverty that may not have the means to play football. As you can see on the screen, we had our staff make skills school videos, and these were sent out via email. They were put on our social media platform, and our younger participants were also encouraged to join us on Zoom, on an online platform where they could see our staff taking part in football and sharing a skill or a trick that they could do at home. Now, the children certainly looked forward, as well as our staff, the children certainly looked forward to these opportunities that took part 3 times a week, because it allowed them to have contact with our staff, who they have come to build up a very strong relationship with. And it was nice to see us able to communicate with them and put a smile on their face, despite the fact that we couldn't do it face to face. Now, one of our charitable aims at Montrose Community Trust is the promotion of citizenship and volunteering. And when best to promote such values than during this time of crisis? And who better to try and promote those values in is children and young people that actually had quite a bit of time and energy to spare. So we launched, in partnership with the EFDN and the Supporter of Each Other campaign, the Montrose Community Trust COVID-19 Citizenship Challenge, specifically for children and young people. And we were going to award a certificate to anybody who did something to help another person. Now, clearly we had social distancing rules to consider. We weren't asking children to leave their own homes to any great extent. But if they could help a neighbour by chatting to them over the wall, if they could spare some time and walk the dog when lockdown restrictions allowed, for a neighbour who was shielding, for example, then great. Now, this young chap on the left-hand side, Reese was the first recipient of our COVID-19 Citizenship Challenge, where he saved up his pocket money. And because he couldn't leave the house and didn't have any other reason to spend his pocket money, he spent it on a box of food supplies. And we made sure that went to a woman who lives on her own, who was really struggling with food insecurity during lockdown. And to see the smile on her face, but more importantly his, because of his good deed, was very rewarding to us. So this is something that we're actually going to continue and carry on post-COVID. Now, Montrose, like many towns across the UK and, dare I say it, Europe, have a food bank. A food bank provides free food and non-food supplies for anyone who requires such. But during lockdown, because people could not leave their own homes, the Montrose Food Bank were complaining of a huge reduction in the number of donations that they were receiving. So our staff and volunteers offered to make contactless collections of donations from the doorsteps of our community. Now, in total, as an estimate, we collected and subsequently donated to the food bank over 2.5 tons in weight of food and non-food items. Now, we drove throughout Montrose to pick these up. As the picture on the right-hand side shows, we drove out into the countryside, to the community, to reach people who wanted to donate, who possibly ordinarily donate, but couldn't due to restrictions. Now, what started off as a few small doorstep collections from households became something much bigger and much better, where businesses that had to close, particularly pubs and restaurants, who had stock that were likely to go out of date and go to waste at landfill, they too asked us to come to their premises and collect bags of crisps and juice and many other food items, jars of sauce, etc., that could be put to good use. And I know for a fact that the food bank would have struggled to meet their increasing demands during this time had it not been for the donations of the public and our ability to collect them on their behalf. Now, people have struggled through lockdown, as we all know, and men in particular in our country and in our town are still struggling. In fact, suicide, as many of you will know and appreciate, is the biggest killer of men under the age of 40. So we had looked to develop a programme called Team Talk, taking a fantastic example from Greenock Morton, a fellow Scottish club, at the stadium, where men would, in particular, women are invited too, but specifically targeted at men and this inequality of men losing their life to suicide, where they would turn up at the stadium and they would sit in the home dressing room and they'd be joined by mental health practitioners, but also football players and football staff. But lockdown put an end to our plans to launch this programme. But of course, it soon allowed us to change our plans, change our tact, and we developed it to run online. So the picture on the screen there is not a picture from one of our Team Talk sessions. In fact, we didn't take any pictures on our Team Talk sessions, so as to protect the identity of those taking part, because we did 2 a week throughout the 10 weeks of lockdown and our COVID-19 community assist scheme. And the Team Talks would involve people joining us via Zoom. They could have their camera on or they could have it off. They could participate or they could just listen. We would be joined by a player from Montrose Football Club, and the players that joined us were always great in sharing stories as to how they support their teammates and their mental health and some coping strategies that they have themselves. The manager of Montrose Football Club, the professional football manager, joined the call too on occasion. We were always joined by a mental health expert who was able to identify any issues and what he was seeing or hearing and reach out to participants and obviously be able to signpost our participants to additional support. And it was always hosted by a member of the Montrose Community Trust staff team, mainly myself on this occasion. Now, what did we speak about? The calls used to last anywhere between 45 minutes and 2 hours. And we started off by chatting through some funny lockdown stories, and I'm sure we've all got a few, particularly in relation to the use of IT, as we're doing now. We spoke about mental health coping strategies. We asked people to share what they were doing to keep themselves well, and we had some great examples of good practice where that's concerned. But we also finished the call, as you can probably imagine, by talking football and having the football manager on the call and a player. It was great to be able just to discuss football, our frustrations at the season coming to an early end, our hopes for the season coming, and being able to get it started again. So the legacy of this is that this programme remains. It continues a fortnightly feature with us online, but we sincerely hope that we can get back to delivering it face-to-face at the stadium soon. Now, at Montrose Football Club and Montrose Community Trust, we have some minibuses that, of course, during lockdown, were sitting doing nothing. So we came up with the idea to develop an essential transport scheme that didn't take much of our energy, of our money, but it provided a valuable resource to many. So there were many in our country and in our locality that were asked to shield because they were considered to be high risk of contracting and suffering from the effects of coronavirus. So our essential transport scheme offered to pick up one person at a time in our bus, sitting right at the back, so as to ensure social distancing. And they would take these people who may be reluctant to get on public transport or didn't have the ability to drive or were affected by changes to public transport timetables. We would take these people to essential appointments, whether it be at the doctor, a diabetes clinic, whether it be through to our local hospital in our nearest city for a chemotherapy treatment, for example. We took people for essential supplies, those that weren't at risk, they weren't shielding, but they just couldn't get into the supermarket. We took them to the pharmacy to collect important medication. But we also, as you can just briefly see on the bottom right, we took children to our local school hub. So our schools stayed open for kids, for children of key workers. So parents who had to go and work on the front line in hospitals. So children were offered care at the local schools. But of course, depending on the time that the parent was working, or depending on their inability to get them there by not having a car, we were able to pick up these children in our bus, one family at a time, and take them to the school hub. We did over 250 individual journeys, and we were very grateful to local companies who gave us funds to pay for the fuel of the transport. But this particular scheme was catered for by our staff. Myself, I became a minibus driver. I fulfilled a lifelong ambition of being able to drive a bus. But we also had volunteers who stepped forward and took shifts doing this on a daily basis. Now, one of the key areas of work of Montrose Community Trust is supporting older adults who are suffering from loneliness through social isolation. We have a number of programs through the week pre-COVID where people come to the stadium and participate in our Walk and Talk program. Walk and Talk does what it says. It encourages people to come with us for a walk around our town and chat, and then it normally finishes with a cup of tea or coffee and something to eat and a good conversation in one of our areas at the football stadium. But in the absence of being able to do that, it was important that we did something different. So we created a database of over 400 older adults that we felt needed our immediate support, emotional and physical support. So we also sought to recruit a number of Befriender callers. So the Befriender callers were ourselves, our staff. We had volunteers who came forward saying they'd be willing to contact an older adult on a regular basis and maintain conversation and create a relationship. Our football players and manager and coaches contacted some of the season ticket holders of the football club that were very used to coming to the stadium and were dearly missing it from their life. So we made a number of calls, but one of the key benefits of making these calls was the ability to identify and react to additional needs. So on speaking to someone merely to try to give them some company and some stimulation in their day, we were able to find out that they had needs in relation to food or in relation to transport, for example. So again, this befriending calls is something that has remained a permanent fixture of our activity at the moment, and I dare say over the winter months it will only increase. Now again, something that we weren't able to do was support these older adults in falls prevention, in increasing their strength, their balance, their coordination to prevent them from suffering from falls in their own home or in their community. So we recruited the Montrose FC physiotherapist, Gemma Collier, and Gemma filmed a number of seated exercise videos, which we were able to stream online and send to our older adults who had the ability to view them. A couple of them were done live, which was hilarious, trying to get everyone on the call and having the video working and being able to hear us and all sorts, and it all just added to the fun and to the relationships that we tried to create and maintain throughout lockdown. Fortunately, we're able to see some of our older adults back for exercise, and fortunately, many of the large majority of the the participants that we reached out to never incurred any issues in relation to physical inactivity and a lack of muscle tone and balance and coordination, and a lot of that is thanks largely to the efforts of the Montrose FC physiotherapist in providing them with some activities to do from the comfort of their own home. Now, as many of you on the call will do, we reach out to older adults who are living with dementia, and in particular look to support their carers in providing stimulation to their day. So we have 5 different football memory sessions traditionally through the week, set both at the football stadium and also out in community settings. Now, these football memory sessions use, as you can see, images, footage, memorabilia, smells to try and reignite fond memories of former players, teams, matches, and events. Now, in the absence of being able to do this, we worked with our partners at Football Memory Scotland at Hampden Park. I think we're hearing from them potentially later in the conference, to make sure that some of their resources and our own bespoke club resources were delivered to the doors of those at home living with dementia. Their carers took great delight in delivering our sessions for us on our behalf, and it certainly brought some much needed relief and stimulation to their day. And if I refer back to one of the quotes from the slide, one of the gentlemen, and he's on the screen, is normally unresponsive, but during the football memory session he was opening his eyes and smiling. It was like a light had been switched on. So we took great pride in making sure that we delivered this session and delivered these resources through the doors of those that needed it most. Now, as COVID continued far longer than any of us would have thought and liked, food insecurity became a real issue in our town. So we worked in partnership with a woman called Teresa, who you see on the screen there, who had a real passion to pass on her grandmother's soup recipes to those that needed it most. So these simmer down, to use a Scottish phrase, simmer down soup bags were delivered to the doors of those that were living in poverty and were facing hunger and food insecurity. They contained vegetables and lentils, stock cubes, and instructions on how to wash, prepare your vegetables, put them in a pan, and let them simmer for an hour. For those that struggled to prepare vegetables and cut vegetables, we were donated pre-packed vegetable packs. And as you can see on the bottom there, we also got some colourful gifts and treats from our local school who wanted to help put a smile on the recipient's face, and they received some rainbows in support of our NHS to display in their windows as well. So well over 3,000 soup bags went out in our town, and not only did they go to those facing hunger, but they also went to our emergency services in support and in thanking them too. Now, our food distribution service only came about later in our COVID-19 community assist scheme because we truly didn't foresee it being required. There is a food bank, there are other resources, but the level of poverty that developed in our town as a result of COVID-19 was incredibly sad. So we decided to launch our food distribution service from our stadium, Links Park, the home of Montrose Football Club. And Monday to Friday, 5 days a week, we would prepare the most delicious, nutritious meals and deliver them to children, families, individuals who were identified as being most in need of such. You can see at the bottom that as well as having a hot meal, they were accompanied by a snack bag, which contained juice, crisps, a snack, and where children were concerned, quite often a toy too. It was a fantastic initiative. You'll see it in the video. It's something the volunteers took a great sense of pride in doing, and it was a real eye-opener. We had a number of volunteers who I would suggest, are quite affluent, and they weren't fully aware of the poverty that existed in our community. And when they went to the door, and the children were desperately waiting for their food, it put a tear in their eye. And I'm delighted to say that we have been able to retain the large number of volunteers that supported us through this project, because they want to help. They want to make sure that our community continues to support those in our community in need of such. Now, in total, the COVID-19 Community Assist Scheme cost us £55,000 in cash to run. Where did we get that? We didn't spend much in the way of our own funds. We would have, albeit it was a particularly difficult time for all organisations. But we got that because the community got behind us and our efforts in supporting those in need of such, and did a number of efforts. So we're able to secure £35,000 in grant funding, particularly for this scheme. Barry O'Neill, who is a director of Montrose Football Club, decided to do a very Scottish task and walk 500 miles, for those of you that know the Proclaimers. We had somebody do a 24-hour cycle challenge on the left-hand side there, and all of those combined efforts raised the £55,000 that was required to do this initiative, and we took great pride in making sure we spent £20,000 of that with local business, in providing the food supplies and the footballs and the activity packs and so on and so forth. So we recruited and retained a number of volunteers through this project, from drivers to cooks to deliverers to those who making befriending calls. And one of the things that I have found most satisfying through all of this is the number of people that wanted to help. And despite the fact that COVID is possibly not as severe with us in Montrose at this moment in time as it was in the summer months, we retain these volunteers armed and ready to go again should we require to launch this scheme once more. That brings me to the end of the presentation. It shows you all the different areas in which we tried to tackle coronavirus and the implications it had on our community. So I'm going to stop sharing this particular screen, and I'm going to try and share the screen of the video. I will be informed by our tech support if it is working or not, so please bear with us. And if anyone has any questions, I will strive to answer such at the end. Montrose Community Trust launched in 2012 with the aim of using the power and widespread appeal of football to inspire change. On an ordinary basis, pre-COVID, we deliver 34 weekly programmes addressing some of the key inequalities that exist in our town. So since we're unable to deliver any of our traditional programmes, we've instead directed our time and effort to the development and delivery of a COVID-19 Community Assist Scheme. And there are a number of strands, all of which are designed to support the most disadvantaged and vulnerable. We have our food distribution service where we prepare and deliver hot meals and accompanying snack packs to those that need it most.
Today we are having pork chops done with thyme and onion gravy and mashed potatoes and sweetbread. We've been very fortunate with donations from people. Start about 8 o'clock, Monday to Friday. I do the cooking part, but Claire's always here to help. Claire does to the front, doing up the bag. You know, all the food that she puts in the bag.
The meals are delicious, and in particular, has put such a great amount of time and effort into the preparation of these foods that are not only tasty, but they're very nutritious as well.
At the moment, I am doing contactless delivery, so picking up hot meals from the kitchen here at Lakes Park and delivering them to the people. I think the benefit that this project is having on Montrose as a community is a very great one. I hate to imagine what these families or individuals might do if they didn't have this available to them.
Well, I've been in Montrose for about 40 years. A wee bit want to put someone back in the community. You know, when you first started, really, we just put it on the doorstep, and a lot of them are shy, a bit self-conscious, perhaps. So it was really a matter of, morning, here you are, have a nice day. Nowadays, it is a chat.
I've been getting steak pie, macaroni cheese,
lasagnas with potatoes, stories.
and it's home-cooked meals. I think that's brilliant that they take the time out their day to do that for people. They stand and chat with you, they ask how you are and how you're getting on.
The community trust does a lot They've been my backbone. My son has autism and learning disabilities and epilepsy. It's been less stressful for us all. It's just been wonderful.
If it wasn't for their meals, I don't know what I would do.
There are a number of people, in particular older adults, who are unable to get to routine medical appointments. So we take them in our minibus, just one person at a time, so as to ensure social distancing, and we take them completely free of charge, let them pick up their prescription or their shopping, and take them back home. And we're also supporting families in getting their children to the hub at Lochside Primary School.
Well, community trust has been helping me to get to like my hospital appointments, well, my doctor's appointment down at the health centre, because with me shielding, it's really hard to get out. When I come out of my doctor's appointment, I just give them the next appointment time and then it's in the diary. It's been a godsend. It's changed my life completely, because if it wasn't for that, I would never have managed to get out of the house and be so safe.
In an attempt to ensure that our local food bank is suitably stocked to cater for the increasing demand, we have volunteers making contactless doorstep collections of donations. And I think to date, since lockdown commenced, we've donated just over 2.5 tonnes.
And honestly, it just makes you feel quite nice that you try to do something.
Whilst I'm talking how good it is for the community, it's also hell of a good for me.
So all of these services that I've mentioned would never have been possible had it not been for the time, effort and enthusiasm of an extensive network of volunteers. So I would just like to thank everyone at Montrose Community Trust, and of course all of the beneficiaries.
Thank you very, very much from the bottom of my heart.
So that brings my presentation to an end. I would just like to thank you all for participating and learning a little bit more about the work of Montrose Community Trust. If anyone has any questions, I'll keep an eye on the chat box. And failing that, I wish you all the very best and hope to see you all throughout the conference. Thank you.